Hey, my name is Nurse Kaylee, and today I'm going to be talking about the CCRN exam, how you can qualify to take this exam, how to sign up for the exam, tips to pass, what to study, and all of the above. So, all right, let's get into it. So, the first question is figuring out if you qualify to take the CCRN. So the CCRN is the Critical Care Registered Nurse certification. You will need to meet AACN's requirements of critical care nursing experience, either being via the 2-year track or the 5-year track. On their website, it'll explain the hours required directly caring for critical care patients, both for that 2-year track and the 5-year track, in order to sit for the exam. And then to verify you meet the requirements to sit for the exam, you will have a supervisor or manager that will verify you meet those hours and that you are eligible to take the CCRN exam. The next step is to apply to take the exam. So as I mentioned, you'll list a supervisor or manager that will confirm your eligibility, and then once that is verified, you will be able to take the exam, and you will have up to 6 months to schedule and take that exam from when you get that authorization from AACN. I would recommend becoming a member of the AACN. The AACN is the American Association of Critical Care Nurses, and through this association, you are eligible to take the CCRN. There's also a PCCN, which is for progressive care, so a step below ICU, often intermediate care in a lot of hospitals. And then you're also eligible to take your cardiac surgery certification. There's additional certifications on top of the CCRN that you can sit for, and you can take as well through this AACN association. I like how the exam fee is discounted. It's a pretty good discount if you're a member. You also, once you sign up, you'll get a monthly magazine from AACN, and it includes research articles. There is also a National Teaching Institute, NTI, and is focused on critical care, and there's one of these conferences every year. If you are a member of AACN, you also get a discount if you would like to attend this conference. I went to the conference in New Orleans this past year, and I'd highly recommend. It's just really cool to meet nurses from across the whole U.S. and from different critical care hospitals, and it's kind of fun to share ideas and see what everyone else is doing in the realm of ICU nursing, and really motivates you to elevate your own care or adopt different styles or share what you're doing with others. It's really a unique way to just kind of learn and grow as a profession in critical care. For studying for the exam, I would highly recommend the Barron's book, specifically CCRN. Barron also has flashcards. I personally downloaded them to my Kindle and found that super helpful, and then I could just review the flashcards, could take it wherever easily. On the AACN website, there's a 25-question practice exam that's free. I'd recommend doing that. The practice exam is the layout that you will see when you take the test, so it's nice to be able to practice that as well. And then on the AACN website, there's a CCRN exam booklet, and it'll talk about the exam categories, topics to study, and it also has a couple sample test questions as well that I would recommend doing. All right, for test day, you have the option to take the exam in person or online. If you're taking the exam in person, you'll need to register for it at an approved testing center. Otherwise, you can also register to take it online, and this is what I chose to do. I will say that if you're taking it online, the exam times fill up very fast. For example, when I took it, it was filled weeks in advance. So I would schedule your exam date a couple weeks in advance for sure, just to make sure that you get the time you want, the day you want. When you take the exam online, there's a proctor, and you'll go through you'll video your desk and your room and things like that. And there's a lot of metrics that are done to make sure you're not utilizing resources when you take the exam. I'm sure a lot of you, though, have done online exams with COVID and things like that, so you're probably familiar, but you will be led through with a proctor when you take that exam. I will say, make sure you have good internet service. I thought my computer was gonna combust because it was so hot after using all the energy to take the exam and proctor, because I don't have the best internet service. So if you don't have very good internet service, maybe keep that in mind and maybe go to a friend's house or go to a library, go somewhere that has like more reliable internet service. Just an idea and just something to kind of keep in mind. To maintain your certification, so once you become certified as a CCRN, the certification will last for 3 years. So you need 100 hours of continuing education to renew your certification. Breaking down like the amount of credits you need 60 from category A, 10 from category B, and 10 from category C. A couple tips for completing this continuing education is to utilize like the filter on the website. So you can use you can filter and say you want to do education from NTI. And this would be, I don't think New Orleans is up yet, so the one previous, and they'll list the NTI videos. So the sessions that people who attend NTI went to in person, you can watch online and get continuing education credits for that. I found that really interesting, engaging. I learn a lot more that way, so I'd recommend utilizing that. And then you can also filter what research articles you want to do, which is good because you need a specific amount from each category. And then there's both videos and articles. So if you prefer to watch videos, I'd filter and only look at that. And if you prefer to read articles, then go that way. There's a ton of education, so it's not hard at all, but it is a little bit time consuming. So I definitely work on it a little bit each year, like every month, every other month, do a couple, just so that you don't have 100 to do in the last 6 months prior to your certification. And then a couple tips to passing the CCRN. I would study a little bit at a time, but pretty frequently. I think I studied for the exam over a couple months, and I would go through the flashcards or go through chapter by chapter, and then the week prior to my exam, I had a week off, so I just reviewed a couple hours every day and then took the exam. I would recommend utilizing all practice questions that you have available to you, and then I would focus on the big categories that the CCRN focuses on, and like cardiovascular, and I would focus on those categories, and then also just strengthening your weaknesses. If there likely will be certain topics that you don't see at all in your current nursing practice. Like, for example, there was a lot on substance abuse, which I don't see a lot of in my ICU. So I studied that, and it was on the exam. So I would definitely, if you focus on cardiac nursing, study neuro as well, or if you don't really see trauma ICU, touch base on that. So I would definitely strengthen your weaknesses so you at least have a little bit above a base knowledge in those parts of ICU nursing you don't see. All right, thank you all for joining this video, and if you have any questions, please let me know. All right, see you in the next one.